Good morning, people. Today we're going to be assessing range of motion of the shoulder, and this is my patient Naomi. So we're going to go through active range of motion, passive range of motion, and then rise arm as well. Thank you, and that's Toby. So we're going to begin with the shoulder flexion, okay? So you're going to ask the patient to put their hands straight to the side, okay? And you're going to do one arm at a time, and you're just going to go all the way up as far back as you can, okay? And the important thing is to look, come over here, if the patient is extending their torso backwards. So you see that's not happening here, okay? Go a little bit more back, as far back as you can, okay? You see how the thorax starts to extend a little bit in the back? We don't want that, okay? So this is as far back as you can go. Do you feel any pain? Okay, so now you put over pressure. You put your hand on the shoulder over here and you go close to the joint and you push. And you're looking for that capsular end feel. Any pain? Okay, you can put your arm down, and then you're gonna do the same thing with the other arm. So thumbs pointed forward, as high as you can. Perfect. Any pain? Put your arm here, and then over pressure once again. Get a little bit more on the movement. Any pain? And you come back. So now we're going to do shoulder extension. So you're going to ask the patient to put their elbows in 90-degree bend. Okay? And they're going to bring it all the way back as much as they can without rotating their body. Okay? Do you feel any pain? And then the same thing. You put your hand here and you push up. Any pain? Okay. And then you do with the other arm. Same concept. Okay? And just come on this side just so we can see. From the front over here. You want to make sure that when the patient brings their arm back, that they're not going back like this. Okay, you don't want any abduction on the movement. Bring your arm all the way back exactly. And you don't want the torso to rotate to the side either, okay? So then you come here and you put over pressure, so hand on top of the shoulder, and you want to be you want to be in line with the patient so you can see their facial reaction if there's any pain. Because sometimes people talk with their face. Well, they talk with their face, but non-verbally. And then you put over pressure. Any pain? No pain. So the next movement we're going to assess is abduction. So you're going to ask the patient to put their arms on the side, and we're going to go one arm at a time. We can start with the left arm, and you're going to go all the way up. Any pain? Okay. And then you put your arm here, and you put some over pressure. Any pain? Okay. And can you do the same thing with the other arm? Perfect. Any pain? And then over pressure again. Any pain? Okay. Adduction we don't assess in this position. So now we're going to assess shoulder external rotation. You're going to ask the patient to put their arms at 90 degrees. Tuck it into your body and then just rotate out as much as you can. Okay? And then from this position, you're going to put over pressure again. Do you feel any pain? And then you're going to scoop here, get a nice grip of the arm, and then rotate outwards. Okay? And then you ask if there's any pain as well. And then the same thing with the other arm. Rotate. It's active range of motion, and then you come in with your arms and you rotate. Any pain? Okay. So now we're going to do shoulder internal rotation. You're going to ask the patient to bring their arms to about 30 degrees, and then to just bring their hand back. Okay, and you want to make sure that the patient is not extending the shoulder and the back to compensate for the movement, okay? Which is obviously not happening right here. So then you stabilize with the arm up here at the shoulder, and then you get close to the joint and you rotate inwards. Any pain? Okay, you do the same thing with the other arm. You're going to bring out your arm around 30 degrees roughly, and then you're going to rotate internally, and then you're going to come here at the shoulder. And you're going to do over pressure again. Any pain? Okay. So now we're going to do shoulder horizontal abduction and adduction. So for horizontal abduction, you're going to ask the patient to bring their arms 90 degrees and bring it as far back as you can. Okay? Any pain? So then you come here and you press backwards to get more movement. And to feel that capsular end feel once again. Any pain? So we'll do the same thing with the other arm. Okay, and you want to make sure that there's not too much rotation of the body happening. So you come here and you push back. Any pain? Okay, and now for horizontal abduction, you're gonna do the same thing, except you're gonna bring it all the way to the other side. Then you're gonna come here. Any pain? Stabilize. Push. Any pain? Okay, and then same thing on the other side. Okay, any pain? And then you push. Any pain? Good. Now we're gonna test we're gonna do more of a test for shoulder adduction, internal rotation, and I guess shoulder extension. So we're gonna ask the patient to sit at the edge of the seat. Okay, and then you're just gonna ask them to reach behind the back. Okay, and then do with the other hand. And you see you get a lot more range of motion with the left arm. Okay, and can you do the same thing with the other way? Okay, other arm. It's about the same. So we're gonna start again with shoulder flexion. So for shoulder flexion, you're gonna make like a little sandwich. Okay? Your elbow is gonna be pointed towards the patient on the side that you're in, so the elbow that's closest to the patient. Okay? And your other arm is gonna go underneath like this. You make a little sandwich, and then you're supported the whole time, like this. Any pain? And then you go close to the shoulder joint, and you press again. Any pain? Okay, and then you come back fully supported. Now, you would of course have to set the plinth at hip level for physiotherapy biomechanics, so you don't hurt your back over time. But this is what we have, so we're working with what we have. Okay, and then you do the same thing, like this. Okay, elbow towards the patient that's closest. And then once again, you go through the active range of motion, fully supported. Any pain? You go close to the shoulder joint, over pressure. Any pain? Perfect. Ideally, you would have the patient sitting a little closer to the edge so that the table doesn't block the shoulder from going, but this is all that we have. Now we're going to do shoulder extension. So it's pretty similar to the other ones that we saw. We're just going to guide the patient's arm downwards like this. Any pain? And come back. And again, you're looking for that capsular end feel. When does it start to get difficult to move? Any pain? Okay. So that was shoulder flexion and extension. Now we're going to do shoulder abduction. And for this one, if I remember correctly, you're going to have the patient's arm like this. Okay? You can hold the patient from the elbow and just have the arm like this, or you can have the arm underneath, whatever you prefer. And then your legs, one is pointed forward, one is back, and it's a pivot. Pivot. Any pain? Okay, and then you do overpressure. Any pain? And then you come back fully supported. Okay? And then you go on the other side. Okay? Same concept. Like this. Okay? And then you go through the movement. It's a pivot foot. Imagine you're playing basketball. Okay? Any pain? And then you overpressure. Okay? And then you come back, pivoting backwards. Okay? So that was for shoulder abduction. And now you can do shoulder adduction as well. You would just take the arm like this. The patient would be more on the side. And you would put them in adduction. Any pain? Okay. And once again, you go like this. Whatever is more comfortable. And you would go down. Any pain? Okay. Now we're going to do shoulder external rotation. And you're just going to bring the shoulder like this. You're going to have it supported. You're going to bring it all the way down for a shoulder external rotation. Any pain? Okay. And for internal rotation, you're going to bring the arms 30 degrees. and then you're gonna bring it down like this. Any pain? Okay. And you stop when you start feeling that capsular end feel, okay? And then we would do it on the other side. So again, supported by the PT, and this is when I start to feel the capsular end feel. That's for external rotation, and then you come in here, 30-degree angle, and then you internally rotate, and then you come back. This shoulder horizontal abduction. So you would come here, have the like this, and then you would go down. Any pain? Come back. The same concept here. Sorry, like this. Supported. Any pain? And then you come back. And that concludes the passive range of motions. Now we're going to do rhizome. So the patient will be resisting your movements. And the cue here is to just say, don't let me move you. You're gonna start with shoulder flexion. You're gonna ask the patient to put their arms at a 90-degree angle. Okay? And you're just gonna have the arm come a little bit in front, like this. And you're gonna tell the patient, don't let me move you, okay? You're gonna come here, and you're gonna push. 1, 2, 3, 4, 5. Any pain? Okay, so if I'm pushing in extension in this direction, then I'm measuring shoulder flexion. So now I'm gonna measure shoulder extension, so I have to pull the patient in shoulder flexion. Okay, so don't let me move you. 1, 2, 3, 4, 5. Any pain? Okay, and then you do the other side. You can down the side. Okay, 90 degrees. Don't let me move you. 1, 2, 3, 4, 5. Any pain? And now we're measuring shoulder extension. 1, 2, 3, 4, 5. Perfect. So now we're going to be measuring shoulder abduction. So you're going to ask the patient to go to a 30-degree angle, and you're just going to put pressure down and up to measure both. Okay? So for shoulder abduction, we're going to be pressing down. So don't let me move you. 1, 2, 3, 4, 5. Any pain? Okay? So you put your hand up here, you stabilize the shoulder, and then don't let me move you. 1, 2, 3, 4, 5. Okay? So that was measuring shoulder adduction. Okay, so now the patient is going to put their arms 90 degrees tucked in. Okay, and we can start with this side here. And now we're just going to tell the patient, don't let me move you. Okay, you ready? Go. 1, 2, 3, 4, 5. Any pain? And then the other side, don't let me move you. 1, 2, 3, 4, 5. So when I'm like this, I'm measuring shoulder external rotation because I'm trying to pull her in internal, so she's resisting the movement. And when my hand is like this, I'm measuring shoulder internal rotation because I'm trying to pull her into external. So let's do the other side. Okay, it's the same concept. Arm on the shoulder near the acromion, get a good stabilization. Hand over here. You ready? 1, 2, 3, 4, 5. And then you switch sides like this. One more time. 1, 2, 3, 4, 5. Okay? Shoulder horizontal abduction and adduction. So you instruct the patient to put their arms 90 degrees. And then once again, it's the same cue. Don't let me move you. Okay? Ready? 1, 2, 3, 4, 5. So I'm trying to bring the shoulder into horizontal adduction. I'm sorry. The patient is trying to bring the shoulder into horizontal adduction, but I'm pushing in horizontal abduction. So we're measuring horizontal adduction of the patient. And then we'll just do the same thing. Keep your arms like this, 90 degrees. And I'm going to pull you forward. Don't let me move you. 1, 2, 3, 4, 5. And you always want to test if there's one arm that's weaker than the other, right? So that's something you should be saying throughout the entirety of the testing. If the arms are normal, then just say feels the same on both sides. Okay, so we're going to measure shoulder adduction. 1, 2, 3, 4, 5. Now we're going to measure shoulder abduction. 1, 2, 3, 4, 5. Very good. And then you tuck it in a little bit. So today we're going to be assessing the scapulothoracic movement, but active range of motion. It's property of McGill University, so no copyright. I'm going to start with elevation. So can you put your arms to the side and just elevate your shoulders? Okay. So we're going to do overpressure and elevation. So can you elevate? Okay. And you're going to go from here. Hand on the acromion, hand on the elbow, and then push up. Any pain? Okay, and then you would go on the other side. Elevate, any pain? Hand on the shoulder.
Overpressure.
Overpressure.
Beautiful.
So now, are you able to depress the shoulder like this? So now we're doing depression of the scapula. So depress. Okay. And now, any pain? You felt pain?
No.
Okay. The other side. Okay. Depress the shoulder. Any pain?
No.
Do protraction and retraction of the scapulothoracic movements. Can you bring your shoulders forward? I'm gonna come to the front here. I'm putting my thumbs over here. I'm making sure not to go into the coracoid process. And then
So make sure you're going.
any pain?
No.
Okay. And now can you retract your shoulders? Any pain? And then you same position, but now you bring it back. Any pain? Okay. Slow again. So now we're gonna do the same movements but passive range of motion. So we're gonna have the patient sideline, and we can put a pillow. Just put a pillow, right? You can put a pillow like this. Okay, and can you just lie down over here? Keep your knees bent like this. Okay?
Yeah.
Okay. Now put your hand. You're gonna have the patient. Can you come a little bit closer? Okay, come a little bit more down. So that the head is just on the pillow. Okay. And you're gonna have your hand over here, like this. I believe it was like this, right? Okay. And for elevation, see, you're gonna like scoop the medial border of the scapula.
Let me just show that right here.
Scoop the medial border of the scapula. Have your other arm up here on the shoulder.
Yeah.
Chromium vibes. And then you're gonna go up. Any pain?
No.
Okay, good. And then you're gonna do the same thing. That was for elevation. Now you're gonna depress. You're gonna go down. Any pain?
No.
Okay, good. So now we're gonna do protraction and retraction. So for protraction, you're gonna squeeze down. Any pain? And then retraction. Any pain?
No.
So for retraction, you're not just throwing the scapula back down. You're gliding it over the spine. Okay? So, and you're just gonna bring it down like this.
Beautiful.
Rhizome now for the scapulothoracic movements. Okay, you're gonna have your patient close to you. Again, you're gonna put your hand underneath the medial border of the scapula to get a good grip, and then the other hand is gonna come in front, get a good grip on the shoulder. Okay. So now we're gonna go into elevation. So Srishti, I probably shouldn't say her name on video.
I'll bleep it.
Don't let me move you, okay? You're gonna push up. 1, 2, 3, 4, 5, and you relax. Do you feel any pain?
No.
Now you're gonna push downwards. 1, 2, 3, 4, 5.
So you're pushing towards there, right?
Yeah, towards her feet. Okay. And now you're gonna take your hand like this, and you're gonna wrap it around the medial border, and you're gonna glide it. You're gonna glide it over the spine. Okay. Don't let me move you. 1, 2, 3, 4, 5. So we were testing when I was pushing it in retraction. She was protracting. So that was for protraction. And now we're gonna try to protract the scapula to test the retraction muscles. Ready? Don't let me move you. 1, 2, 3, 4, 5.
So now you're bringing it towards you.
Yeah. Very good. So now we're gonna start the palpation portion of the video. along the edges is what I like to call it. So we're gonna start with the spine of the scapula. Okay, so
On the
first of
edge.
all, make sure that the patient has a nice towel that's folded like this. Okay, you just fold it in half, lay it down, and then there's a video, we'll plug it in after. Okay, make sure the patient is comfortable. Make sure the splint, the plinth, whatever you call it, sorry, is at your hip level.
Yeah.
Okay, and now you're gonna start palpating. Okay, so you start palpating. Now we're at the acromion, and then you're gonna feel this curve around here. That's when you know you started going to the spine of the scapula. Okay. Now you're gonna come to this intersection here. You can either go down for the medial border, or you can go slightly above, and you're gonna get to the superior angle of the scapula, and it might be a little bit tender. Right here. How does that feel? Tender. There we go. Then you go down the medial border of the scapula. And then you'll feel the inferior angle. If you want a trick for that, you can even ask the patient to put their elbow like this and
You can really see it.
Look how it pops out right away. Okay? So then you can put your finger here, have the patient put their arm back down, and then you can follow it. Follow the lateral border of the scapula, but it gets lost into the soft tissue, so this is all that we have for now. Okay, so that was everything for the along the edges. So now we're gonna start the in the trenches.
In the trenches.
Okay. So you want to palpate the supraspinous fossa, but how do you do it? So you start at the spine of the scapula, and you know that the supraspinous muscle is just above the spine of the scapula. So you ask the patient to relax. Don't let me move you. Okay, so don't let me move you. And then you can feel the supraspinous muscle buckling up right
So
here.
you're pushing against.
I'm pushing against her. I'm pushing an adduction,
So she's abducting.
and she's abducting, exactly. And then you can feel it. So now we want to find the infraspinatus muscle. Sorry, infraspinatus. So once again, you go to the spine of the scapula, and then you put your fingers right underneath, because that's where the muscle is. It's right underneath the spine of the scapula. Then you put the patient's arm to the side like this, and then you tell the patient, don't let me move you, and then you push down. And then right away you can feel the muscle activating.
So one more time.
So you put the patient's arm in this angle, and then the patient technically wants to bring the arm up. But make sure that there's no internal rotation happening, because you won't get the proper movement, okay? So bring your arm up, and I'm resisting, and right away I can feel it right here, this infraspinatus muscle. For the teres minor, because it's in close proximity to the infraspinatus muscle, I go slightly down, and I ask the patient to externally rotate their arm, and you can feel it right away. Okay, so for supraspinatus muscle, you locate the spine of the scapula, and then you go just above it. So this is the spine of the scapula, and you go just above. At the moment the muscle is soft, so nothing's feeling here. And then you ask the patient to resist your movement. I'm pushing her in this direction, and she's gonna push against me. So resist the movement, and then you can feel it right here. Okay, supraspinatus muscle. And you can also, continue, resist. You can also continue to palpate it, and you'll feel it all the way here to the insertion point. Okay.
Yeah. I mean, relax.
Oh yeah.
And she told me like, bring the arm forward and like push your thumb. I don't feel any stuff. I mean, also.
Okay. So here, pull forward.
What am I forgetting?
Oh yeah, right here.
Ow.
What's up, Scott? Part 2.
Yeah.
You take the arm of the patient, and you pull forward, and you have your other arm under the medial board of the scapula, and then you go underneath the armpit a little bit, and you push up. You should feel the muscle. So we're gonna do deltoid muscle. So deltoid's action, like a majority of the action, is abduction. Okay, so it's best seen when you do an abducting movement. Okay, so can you just bring your shoulder out this way?
Yeah.
Okay, and then you can palpate it like this. You can also tell the patient to resist the movement. Resist, don't let me move you. And then you feel the muscle bulk, and it comes to an end. and that's going to be your deltoid tuberosity. Spinal scapula, acromion clavicle, AC and SC joints. So acromioclavicular and sternoclavicular coracoid process. And we're going to do deltoid muscle and tuberosity. We're going to continue our palpations a little bit. Just going to move the hair around. So we're going to continue by palpating the spine of the scapula, and we're just going to follow it around the shoulder, okay? So you're going to follow it around, and you're going to go to the acromion. Acromion, and then we're going to go to the clavicle. So clavicle. And then we're going to get to the SC joint. So can you elevate and depress? Again? Okay. SC joint. And then you follow the SC joint all the way to the AC joint. Elevate. Okay. AC joint. And then we're also going to look for the deltoid muscle and the deltoid tuberosity. So you're going to ask the patient to, in her case, her arm is hurting her, so we're going to do the other side.
It's not that far off, so it's like a big.
You're going to ask the patient to abduct a little bit.
Yeah, here's the big groove.
Okay. And then the belly of the deltoid is right here. Okay. And then you're going to ask the patient to resist your movement. So don't let me move you. Like this. Okay. And then
Can I guys sit on the table?
you can feel a deltoid tuberosity right here after palpating for the deltoid muscle. As you're going through the AC joint, you go a little bit in front, and then you drop down, and then you should feel a little sensitive spot right here. Okay, it's where the short head of the bicep attaches. Okay, so for coracoid process, to make sure that we're on the right anatomical landmark, you can also ask the patient to externally and internally rotate the arm. So can you externally and internally rotate? See, my thumb doesn't move, but if my finger was here, do it again.
Yeah, your thumb's moving.
It's moving, and that's not me. Okay, so now we're going to look for the greater, lesser tubercles and the intertubercular groove. So you're just gonna have your patient sit straight and make sure that they don't look at what you're doing, because that's gonna change the range of the. It's gonna make it harder for you to find it. Okay. You're gonna have the patient's arm like this, and just have it rotated, and then you can feel that there's a bump, a groove, and then another bump. Oh yeah, you feel it right away. A bump, a groove, and another bump. Okay. So this bump here would be your greater tubercle.
Yeah.
This would be the intertubercular groove, and then that would be the lesser tubercle. And to confirm this hypothesis, you can ask the patient to keep the elbow like this and to don't let them to resist against you. And then you can feel right away the biceps tendon pop. Again.
How did you get your finger to that position? Where did you follow?
So you can either go from the spine of the scapula, you get to the acromion, and then you go down.